Hello, scholars. My name is Dr. Karis Dillon, and the goal of this channel is to make academic subjects easier to understand. In the last video, we covered delusion disorder. In this video, we're going to address brief psychotic disorder. So let's begin. In order for an individual to be diagnosed with brief psychotic disorder, they have to have one of the following three symptoms: either delusions, hallucinations, or disorganized speech, with periods of difficulty in understanding what the individual may be saying. The individual may also show a fourth symptom, including disorganized behavior or catatonic behavior. They also must have at least one of the following three symptoms for at least 24 hours, but less than 30 days. In this period of time, they will return to their basic functioning. In your observation of the individual, it's important to rule out major depressive disorder as well as bipolar disorder with psychotic symptoms. It's also important to rule out schizophrenia as well as catatonia. Make sure to observe and ask about whether the individual has used drugs, abused medications, or alcohol when trying to diagnose this condition. Medical conditions will need to be taken into consideration. You'll want to also specify if there were symptoms that came about because of a stressful event or multiple stressful events. These will be called marked stressors that brought about a brief reactive psychosis. Let me tell you that one more time. These will be called marked stressors that brought about a brief reactive psychosis. So if the individual did not experience any life stressors, but the brief psychosis occurred, this will be known as without any marked stressors. It must be noted and specified whether the individual is pregnant or within 4 weeks of giving birth, because this can bring about a brief psychotic episode. You'll also want to specify if the brief psychosis has catatonia or not. Remember that catatonia is when the individual seems to be in a stupor. They may show being rigid, or they hold a particular posture that is not normally seen given the general public. It is also important when diagnosing brief psychotic disorder to rate the severity of the key features, including delusions, disorganized speech, hallucinations, negative symptoms, and abnormal psychomotor behavior. There is a 5-point scale that is used, and 0 means that the individual does not have the symptoms, but 4 to 5 means that the symptoms are present and severe. The main way to set apart brief psychotic disorder from other mental illnesses is to note the sudden nature, basically very quickly how one of the following symptoms comes about, including hallucinations, disorganized speech, delusions, large and abnormal movements or behaviors, or with or without catatonia. The individual will go from their average set of behaviors to a psychotic state within a 2-week or so period of time, but this cannot last longer than 30 days. The psychotic state has to last 24 hours for it to be considered brief psychotic disorder, though. They also have to return to the normal behavioral state of mind as well. If someone is going to misdiagnose a patient with brief psychotic disorder, the most likely misdiagnosis would be bipolar disorder with psychotic features, schizoaffective disorder, major depressive disorder, or schizophrenia. Finding out whether or not someone has taken illegal drugs like a hallucinogen is important to rule out. Individuals with this disorder will present with lots of confusion and will generally be emotionally distraught by what they are experiencing. They may shift from one strong emotion to another. Given that a psychotic episode may be quite severe, the individual will need to be looked at or after to ensure that they're getting enough to eat, that their nutrition is adequate. You want to make sure their hygiene issues are being taken care of. They may need help with good judgments, and to make sure they're not doing something that they shouldn't be doing, or that they're not acting out based upon those current delusions. There can be an increased risk to that person that they may attempt or complete suicide. So it's very good to have somebody watching over the individual. Females tend to be more affected by brief psychotic disorder than males at a 2-to-1 level. It can appear when the individual is a teenager or in early adulthood. It can come about at any age, though. The most common age to experience brief psychotic disorder is in the 30s. Even though the symptoms can last for up to 30 days, it's normal for individuals to only experience the symptoms for a few days. If a person has a personality disorder or strong traits of one, they may be more apt to develop the disorder. A diagnosis of brief psychotic disorder cannot be used for cultural or religious ceremonies in which one may hear voices or experience others talking to them that aren't there. That would not be considered brief psychotic disorder. Anything cultural or religious, they stay out of. For those that experience brief psychotic disorder, the outcome is usually really, really good for those that experience it. There is an increased risk that these individuals will have symptoms relapse later, though. It cannot be underestimated how important it is to get a medical exam. If someone is experiencing psychosis or delusions or hallucinations, it's really good to be able to rule out Cushing's syndrome and brain tumors or injury to the brain, because this could impact that individual in this manner. Also, drug and alcohol screening during a medical exam could be very, very helpful. All right, well, that is the end of our video. We will be covering schizophreniform disorder as well as schizophrenia. So you're going to see a lot of the symptoms be the same with these disorders, but schizophreniform disorder is going to have a different amount of time that these symptoms are going to go on compared to schizophrenia. So these three are kind of in combination with one another. There are still some psychological or psychotic disorders that we will cover within this part of our series about psychotic disorders. So please stay with us, and I really appreciate everyone. I hope that these videos are helping you through your tests, through your quizzes. I know that you can do an amazing job. We need so many more people in the clinical field, either as a nurse or as a counselor. So I just appreciate everything that you're doing concerning mental health, and know that we've got a whole world to look over and make sure that people's mental health is okay. So I thank you greatly. Please click that like button if you like the video, and don't forget to subscribe. Other than that, I hope you have an amazing day, and I will talk with you soon.